Hello, my name is Courtney Skutak and I've been a nurse for 2 years. Today I'm going to talk to you about gender inequality in the nursing profession. It's important to understand that social practices have been shaped by diversity in modern culture. Diversity involves different dimensions that make up individuals such as gender, race, religion, age, education, and ethnicity. As the population becomes more diverse and adaptation to different cultures occurs, social practices then begin to change. The term culture lag is responsible for the time it takes for society to adjust to the changes in social practices and also be recognized by a legislator. The sociology of diversity influences modern society as well. The mix of different cultures and beliefs shape social practices. It is important to be culturally competent and respect the diversity within society rather than point out or shun different social practices. Diversity influences social change by different cultures, practice, and advancement in science and technology that transform modern society. The members of society also learn to adapt to these changes and adjust their way of living in order to fit into society. Not only does diversity influence social change, it also influences the behaviors and operations in the nursing profession. Nursing tends to be viewed as a female profession, which shapes gender inequality. Nurses also need to be culturally competent when caring for their patients. All patients have differences in cultures, beliefs, and religion, which impact their health care. Modern society is impacted by changes in diversity as well. Social practices have changed and will continue to change, and society needs to learn to adjust to them. Issues of diversity such as gender inequality and discrimination based on race are examples of how diversity affects society and their way of life. In nursing, gender inequality causes more job opportunities and better pay for males than females. This is an unfair practice which pushes people to advocate for social changes. The benefits and challenges of overcoming diversity is important. The benefits include different views and opinions, better ideas to promote a successful future, and more productive work environments. The challenges of overcoming diversity include recognizing value of differences, combating discrimination, and promoting inclusiveness and equality. Gender inequality in the nursing profession causes males to have more opportunities than females. Nursing is primarily viewed as a female profession as only 7% of nurses are males, which leaves males within the profession to be viewed differently than females. Male nurses are often viewed as weak or homosexual due to the perception of the nursing role is still to be caring and nurturing. Societal stereotypes and gender bias occurs for males as it is still viewed and primarily consists of females. Due to the scarcity of males in nursing, they tend to get paid more, have better job opportunities, and tend to get promoted into management or administrative positions than females. Even if the male nurse and the female nurse have the same level of education or experience, or if the male even has less education and experience, males still tend to get better opportunities than females. This chart demonstrates the impact of gender inequality in the nursing profession. It depicts the population of nurses to be primarily females, who make up 93% of the nurse population. It also shows the differences on median earnings between male and female nurses. As you can see, males make approximately $10,000 more than females. This chart also demonstrates the differences in job satisfaction, as 90% of females are satisfied compared to 84% of males. Male nurses may be less satisfied with their job due to society's negative perception of the nursing role. The target population are individuals, both male and female, in the nursing profession. Male and female nurses are both affected by gender inequality. Males due to gender bias, and females due to males getting better pay and job opportunities in management. Gender inequality in the nursing profession relates to the diversity issue as a whole due to gender inequality occurring not only in nursing but in other workplaces as well. Gender inequality relates to diversity due to the differences in socially constructed gender roles within the society. Occupations are then stereotyped as male or female professions. Nursing is viewed as a female profession, creating gender bias for males. Males are often paid better and offered management positions over females due to the bias of male power and the scarcity of males within the profession. Males are often scrutinized by society for holding a profession in nursing due to gender bias. A survey involving 51 male nurses showed they were affected by stereotyping and gender bias. 42% experienced gender bias in nursing school from faculty and nursing staff, while 75% experienced gender bias as a working professional from nursing staff, but only 8% from female physicians. Females are also affected by males being paid more and offered better opportunities. In 2010, the median weekly salary for male nurses was $1,201, and for females it was only $1,061. Males have an easier time getting hired into management and specialty positions such as a nurse anesthesiologist. Males make up 45% of nurse anesthesiologists, which is among the highest paying nurse specialty, while females tend to be hired for Gender inequality in nursing is predicted to change as males are pushing past gender bias and females are advocating and fighting for equal pay and opportunities. Social change will occur in the future and gender bias will be minimally existent in nursing. Recommendation and strategies are needed in order to plan how to overcome gender inequality in nursing. Society will adjust to accepting males in the nursing profession in the future. Education to society regarding how nursing has changed from a once nurturing role to modern society, which involves more medicine and technological advancements to eliminate gender bias for males in the future. For high school age adolescents, hosting job fairs or college fairs with male nurses present to provide truth of the role of nursing and clear up misconceptions within the profession may help. This will hopefully encourage more males to enter the nursing profession as they will have a better understanding of the role of the nurse. Females of the same experience, education, and job should be paid equally as males. Advocating and fighting for equal pay regardless of gender in nursing by forming committees to meet and discuss how the change can be made. Guidelines for criteria around pay should be established. For example, higher degrees in nurses like master's degrees and longer experience should be paid more, but equal amongst genders. Equal opportunities in management positions should occur with regard to the applicant's gender. This will allow females to have the same opportunities in management as males, given they have equal education and experience. After recommendation, strategies are used to develop the plan. Implementation occurs. Education for elimination of male bias will occur in high schools and nursing schools through hosting job fairs and college fairs. Explanation of a nurse's responsibility will be discussed to show that nursing does not just involve being nurturing to patients, but a lot more as well. Supplemental resources, such as handouts, will be given at the presentation for students. Equal pay will be advocated for through committees at every healthcare center that gender inequality exists. Assessment and evaluation of the current pay discrepancies among gender needs to occur first. From there, the development of guidelines for criteria to establish pay raises as those with further education and more experience should be paid more than those fresh out of nursing school. However, pay at each level of education and experience will be concrete without discrepancy due to gender. Equal opportunities for management positions will also occur. Requirements for management positions will be set and not overlooked due to gender. The amount of experience and education required for these management positions will be without regard to gender. The benefits of this plan is to encourage more men to become nurses. In 2000, only 5% of nurses were males. However, in 2013, this increased to 11%. This number will hopefully continue to rise as gender bias decreases and education continues to occur to society as well. Equal pay will prevent advantages based on gender and create a fair and balanced work environment, promoting social change beyond just nursing to establish equal pay and eliminate discrimination based on gender. The reduction of turnover rates due to a tense and negative work environment, as female nurses may feel unappreciated, will also reduce. Equal opportunities for management positions will hopefully reduce the turnover rates, as nurses will enjoy their work environment and stay in their jobs longer. Whether a person is a male or a female, a nurse is a nurse, and they are devoted to providing their patients with the highest quality of care they can do. Thank you for watching my presentation.